The patient has a fracture requiring a below-knee back slab to stabilise the fracture and promote healing. Ideally, an assistant is preferred. Position the ankle joint at a 90-degree angle, although this may vary depending on the type of injury. A stockinette is applied over the skin to prevent itching and irritation from the undercast padding. Leave this slightly longer at both ends than you would intend to plaster. Starting proximally, the undercast padding is laid over the stockinette. It should fit snug, but not excessively tight. Aim for a tension just enough to take up the slack. Work your way distally towards the ankle joint. Make sure positioning is maintained. Again, progress distally towards the toes, further than you intend to plaster. This will make it comfortable at the toes once the two layers are folded back. Again, check and maintain the position at this stage to avoid creasing in the wool, which can lead to the plaster slipping, causing discomfort. Cut a strip of plaster to make the stirrup. This should be measured from below the knee, down under the heel, and up the opposing side to form a U-shape. Submerge the length of plaster in water for approximately 4 seconds, aiming for a consistency that sticks to the undercast padding, allowing the stirrup to set. Using a gloved hand, work the plaster to fit the shape of the lower leg. Notice the plaster sticks to the undercast padding independently, meaning the correct consistency has been achieved. Using 6 to 8 layers of plaster, the back slab itself is measured from just below the knee to the toes. The plaster can be trimmed if it is too long. Submerge the plaster in water for around 4 seconds. Lay the prepared plaster posteriorly, smoothing the edges up over the medial and lateral malleoli, as this is the most articulate component of the ankle joint. Trim back the stockinette, reflecting it to reveal the toes, which should remain warm and pink. Apply a crepe bandage, starting at the knee towards the ankle. Trap the reflected stockinette and underclasp padding neatly under the crepe bandage and head back towards the knee. Include the folded back stockinette and padding at the knee. Finish by sticking down the end of the crepe bandage using an adhesive strip or tape. Whilst the patient is immobilised in a back slab, they must remain non-weight bearing, using crutches to mobilise. Remember to document the neurovascular status of the foot.